जय जयेंद्र देवेंद्र भाई.
Hi, Cyril. Sujacha.
बस एकदम fine.
Very good. Good, good.
If you want to start, uh, it's already 8, so you can start. That's fine.
David Rajwe. Hey, Samjia. She likes to be here at the beginning. Let me just check she's coming.
Okay.
Okay, so let's start. Could it be taped? All right. Welcome, everybody. We're going to talk about evidence-based practices for yoga trainers. These are basically looking at yoga for hypertension, yoga meditation, pranayama also, and some discussion mudra. The idea is to look at the randomized control clinical trials, the best data available. And some Dr. Raj touched on yesterday, so we kind of familiar with that already. And it's in the new recommendations in USA even for blood pressure management as a good option to incorporate. All right, so already looked at vessels. We know hypertension is high pressure, and normal blood flow is on the left, and then it thickens. So you can see in the picture, the wall is thickened and it's plaque form. So then the vessels have more resistance they have to go through. And so a lot of diseases emerge from that. These vessels supply everything, right? From a heart to a brain to a kidneys to a legs. So where they are affected, you will then have disease in that organ. And then your blood pressure over lifetime keeps hitting these vessel walls so that over time this happens with other factors that was very well discussed yesterday and the day before. Just summarize. So hypertension, chronically elevated blood pressure, right? So blood pressure is high. It's like you're running all the time. You're running or you're fighting, let's say, then your blood pressure high. You need to be high. But in hypertension, you like that all the time. Blood pressure like all the time, which is what damages. And one of the key things to understand is the stress factor, right? So sympathetic overactivation. We were talking about sympathetic, parasympathetic, right? It's the same issue here. You get vasoconstriction, which is that the vessels are getting narrow because of what your cortisol and adrenaline do. They narrow your vessels to increase the pressure, and they also increase the heart rate so that you're getting ready to use your blood more effectively. So stress is a response to fight or fright, and you're ready to run or defend or move quickly. So stress's job is to look after you in that setting. But when you do it all the time unnecessary, that's when you get major risks of heart disease, stroke. And then why would yoga work? Well, yoga is parasympathetic. We talked about it. Vagal nerve, parasympathetic, the left side of the body. And so yoga will balance that and relaxation, and then the vessels are dilated. So that's kind of all makes sense. All makes sense. Very consistent to what we've been talking about since beginning of this course. So there are many studies, and sometimes when there are many studies, what they do is a meta-analysis. They put all the studies together and then show you a bigger number of how the studies connect, and so you get a better idea rather than one study versus another. So meta-analysis are a good way to put a lot of good studies. When they do this, they look at the studies of quality. They rank them as quality before they pull them together. Okay, so for example, in 2013, Haggins et al. There's 17 trials they put together, and what they found essentially is, on average, right, your systolic blood pressure, SVP systolic, that's the higher one, is down by just under 5, and the diastolic is down by just above 3 or 3.5. And then what they also found is that when programs combine asana with pranayama and meditation, all three things, the benefits improve to about 8 systolic and about 6 diastolic. Okay, so what this tells you, this average. Now, some people will have 50% more, some 50% less, and in different days there might be differences, but it tells there's a consistent effect, and this is an important effect. It's not unimportant. Another study found a very simple thing in 2022. They reviewed 34 RCTs. Again, so all of them emphasize that yoga is an adjunct, right, to medical care. The amount of benefits you see is not enough to treat hypertension. Normally you used to go by 15, 20 down, but this can be a good adjunct so that your baseline is good, and then your medicine requires less, and you can imagine long-term benefits. But what I read in this is a preventive, which is, of course, also studied, but not so well. Imagine doing this early, raising your kids doing it, and people start early, then when they have a family history and hypertension, it'll be later and milder. So your overall disease duration is shorter, medicine use is less, and so I think one of the best things this shows you is how to prevent. So this is some of the plots which are useful to show. So systolic drops down, diastolic drops down in the 7 studies reviewed by Haggins. And then the comprehensive one where you had everything, yoga, pranayama, and meditation. The improvement was better. And because of the number of patients, these are very true differences. And then finally, in a more recent review, they found similar differences. Okay, so that's really helpful to show to clients. It's an infographic I've created which shows you yoga for arterial hypertension. And so this is quite handy. We'll be one of the things we'll put in a sort of flyer mode so you can have it. And in the intervention group, we had asanas, pranayama, meditation, and about 8 was decrease in blood pressure, right? And then how they did the waitlist or control groups randomized, and then the group that they taught yoga. Some of the studies use exercise as your control versus yoga, and yoga is then better than even exercise. The exercise is, of course, good, as we heard yesterday. Okay, it's a very effective strategy. This is a good review, which of course you'll be having access to, and I think a good review to kind of summarize for your patient, for clients. Look, this is what the data shows. And this is RCTs, right? RCTs, and particularly good studies that you can trust, like any medicine. What they used, well, the asanas they used were gentle twists, support bends, supported or unsupported based on age, cobras. And again, for hypertension, they don't have to do the fierce ones, gentle ones work. Repeat gurney, we talked about why that would help because your head is at the bottom, your one is up top. Cat cow, on Asanas, and slots. All those we know. And it all makes sense. When we do them, we talk about potential benefits of blood pressure. Generates, one of the things that they emphasize is tall spine. Key part in blood pressure is no breath holding recommended. Now, of course, you're well treated and you're low blood pressure, your doctor says, okay, you can do that, but generally, breath holding is not recommended when you're hypertensive. Of course, you should props and avoid compressive poses that are constricting. Okay, so that's generally what they recommend. Additional studies since those reviews in 2025, another one, which showed about 8. So the theme here is that they all show similar differences, right? So we know it's real. It's about 8 minutes systolic, about 4 to 5 diastolic. So you can guarantee to your subjects they're going to get this, maybe more, maybe less, but this much is realistic. Okay. And again, they found the same thing that if you do asana with breathing and meditation, then you have a bigger effect. So you want to be a combined thing. Mudras, they don't talk about this. We'll touch on that a little bit, but certainly these are the ones that data show. Now, the pranayama they used is slow diaphragmatic breathing, Nadi Shodhan, Brahmari. Again, things we do, you imagine Shitali, Shitkari, gentle Ujjayi. But again, avoid retention. Kumbhaki don't do, right? Because hypertension, you already know it doesn't make sense. So you shouldn't do that. You can always figure it out yourself. That doesn't make sense. When you're holding breath, your blood pressure is going to go up. So how does pranayama help you do yoga? Well, similar, right? If you slow your breathing, and somebody says every hour after work, if you stop, slow down the breathing, you can imagine why this is effective therapy. Your average blood pressure is going to drop. You do a parasympathetic dominance, right? So you're going to have the balance. And then you're going to reach the heart rate. When you dilate your vessels and relaxed, then the resistance of blood flow is less, which is the work of the heart is less, right? So you relax, and the heart has to work less hard to deliver the blood and the oxygen and take the toxins away. And also less stress hormones. All right. So this kind of makes sense. Again, you know all this in many diseases with the same benefits, but here, particularly for blood pressure, it relates to heart rate and resistance. All right. So pranayama, I have another infographic together. So meta-analysis 2017, they found again more. This is more just pranayama. Okay, they found the blood pressure dropped by about 6 in a duration of a 6-month study. Another study used compared the alternate nostril breathing, Nadi Shodhan version or Anulom Vilom, and they found the blood pressure go by about 7. Right. And then another study which is so slow breathing, deep, slow breathing that some of you teach us also. And they found there's some benefit, but some evidence that is limited, but some benefit. So mindfulness alone isn't necessarily as good as combination, but it helps. It of course helps other things. We talk about blood pressure numbers, we talk about stress, anxiety, of course helps there. So we talk about specifically looking at blood pressure variables, generally, of course, very helpful for other things. The guidelines generally are 6 to 10 breaths per minute, 20 minutes daily, 10 minutes daily, and avoid any breaths. Again, same guidelines. And again, I would say you could do this many times a day, right? If you're every time you're working for an hour or a break, like some advices, that makes sense, right? You could do a few minutes of break, relax, get blood pressure down, reset yourself, off you go again. So it's telling you why that was such a powerful advice. All right. In terms of relaxation and meditation, well, the studies have used yoga nidra, mindfulness, which Buddhists influence, that also others do, guided imagery, and others use Tritaka. Tritaka is something you talked way back at one of the talks, is where you focus on a particular point and keep focusing. We've not practiced it a lot. Maybe we did at some point, but this is one of the techniques that they've used in these studies. And they help. In addition, they help improve sleep and stress resilience. So next time you have a stressful event, you're more resilient to it, and that is preventive as opposed to treatment. So that's an important finding when you use medication, relaxation, fatigue medication. So the different ways they help, and so just because your heart rate, blood pressure can change a lot, it makes you more robust for next time, and overall you calmer. You can see how it feels to a much healthier person relate to heart disease. All right, and so there's some RCTs, and again, this table shows you some of the changes. So in terms of mindfulness and meditation, some studies show up to 5 reducing systolic blood pressure is a higher one, and a little bit less on in the lower one. But some studies are not clear cut, so there's studies that change. Now, this particular study, mark control is your progressive muscle relaxation. What they did is one group they showed the yoga that you would do, or it is in this case it's mindful based reduction. The other group, they just taught them how to relax a muscle without meditating, to show that the effect is your mindfulness, not just relaxation. It's very important. They showed that it's not just sitting relaxed, won't do it. It's that mindful relaxing, like they say, guide you're using mindful stress reduction, as opposed to just relaxing your muscles. So I like this study because it breaks apart. It's not just you're relaxing muscles, you're actually using mindfulness. Let's say, that works. So it is a very interesting study they did. It's very helpful. All right, so they did body scan, sitting meditation, and a little bit of yoga to break things, but basically the focus was on body scan, like Herzog, and sitting meditation, which is like picture there. Right. So you can see it's more powerful than just relaxing. Very important. The mudras, they deepen awareness, promote relaxation. They're safe and accessible. While the evidence is limited, they're often part of the complex yoga therapy. The product playing a role. It's just basically study them independently. It's not in other areas of disease we covered. So the area of research and something we could look at probably. The ones that have been used up with the infographic on it is Apanvayu, Akash, Pran, Vayan, and Chinmaya. Some we know, some a little different names, the ones we know, and we'll go over them a little bit more. So that we clear in mind what they are. All right, so these are another infographic for mudra for hypertension. Apanvayu mudra is left, which we know, right? It's his heart mudra. It reduces blood pressure, relieves angina. Angina is where you get this crampy pain, is your vessels kind of spasming. It looks and feels like heart attack, but relaxes, so you're kind of okay. And people take the medicine, the tons sometimes to open that up. While it's not heart attack, over years it can lead to heart attack. So of course it's angina. So this study showed potential decrease blood pressure and improve cardiac function just by Apanvayu mudra. So they measured some benefit. Okay. The study is not for RCTs, high quality, but they show support the idea that will help. Pran mudra against lipose mudra, as we know, increases vitality, reduces fatigue. So it's likely to improve circulation and reduce stress levels, so enhance overall energy. So this is coming more from studies done in certain settings. Akash mudra reduces negative emotions, promotes calmness, connects to inner space, and it enhances the parasympathetic activity, which is what we want to reduce stress. And Bayan or air mudra, which we know there's some of this may not be entirely correct. This is the Bayan mudra, regulates nervous system balance and balances the air element. Links to stabilizing autonomic nervous activity and improving respiratory efficiency. So it's sort of the ring finger of the thumb. I think I think it's correct. I think it's correct. Is correct. And Chinmaya mudra, awareness mudra, which is basically holding your 3 fingers up like that and pulling like that. It's new to me. It's light modification of the one we do, like gallbladder. So it promotes structured breathing, induces calmness, and improves energy flow. So it's one of the ones that in a couple of studies was used for blood pressure. So it's worth knowing it, that those used. Doesn't mean that we're going to use all of them, but just to know what they use in studies. Okay. So I've listed them again here. So upon by we know index finger to base of thumb, and then touch the tip of thumb to tips of middle and ring fingers. Akash, we join the tip of the thumb to the tip of the middle finger. Vayan is place the tip of the thumb against the tips of both the middle and the ring fingers, middle and ring. Chinmaya is the thumb to index finger and curl of the fingers into the palm. And prana, like first, which is thumb over the tip of the curled ring and little fingers. Okay. So, oops, sorry, just 1 second, we'll get back to that. So that's kind of what they are. How do you design a class? So now we get any questions up to now? We can talk about how to design a class as a general approach, how some of the studies use it from other yoga guides. Very straightforward. You basically perhaps want to do centering and breath kind of 10 minutes. Then you do our gentle warm-ups that will be more like the subtle yoga. Then you can start going to a therapeutic asana for about 20 minutes. Then a cooling pranayama, and then you finish with kites, I guess as we would say. So that is soothing, calming, non-competitive. It's nobody else, it's not competing with somebody, not straining any part of your body. Key motive is to keep the head level and above the heart. And the heart should be lower so that it has less work. And smooth breathing or rhythmic breathing. Generally, the studies use an approach like that, where they combine it. If people are less mobile, then you can, of course, do half forward pose with chair. We did a lot of chair yoga, downward dog at the chair or the wall, supported bridge with block. You prefer, and then side line relaxation if supine is uncomfortable. So you can do different ways of relaxing. And again, it's effortless, smooth, no strain, and props encouraged to make it easy because we're trying to control blood pressure. All right. So this is a boring but important slide. It tells you what to worry about. So when you have your clients, you ask about blood pressure history, amongst other things, and particularly the medicines for hypertension. And if they had symptoms of chest pain, headaches, dizziness, because there's all clues that maybe it's more going on. And you might guide them to make sure they're with them, saying, doctor, recently go back and see them for you, work with them. The ones that require medical is if the blood pressure is over 180 or 110, then you absolutely cannot touch them. They might have headaches, and of course, that's go to the doctor, maybe go to the ER based on how quickly it occurred. And particularly if they come to have new or worsening headaches and a history of blood pressure, as we heard yesterday, can be a presentation of bad hypertension. If they've changed in the eye, vision, or some chest pain, of course, we know that, but it's nevertheless a list that's covering these. You particularly want to avoid inversions, headstand, shoulder stand, or plow, unless for some reason a mild control in your position is going to help you. Breath retention we talked about, you want to avoid that. A couple about the Vasika, as you know, particularly Vasika we'll avoid. And heart vigorous airflows and any straining poses, you want to avoid those because they're going to increase your blood pressure short time, and we don't want to do that probably. And then, of course, safe, which as we talked about in contrast, as head level or above the heart, lots of props so you're relaxed, fit in your cooling restorative practices a lot, and then slow transition so that you're not going to get sudden blood pressure changes, shifts, and get up suddenly, lie down suddenly. Then, you know, when you have blood pressure, particularly on medicines like beta blockers, you can't handle that. The medicines are going to limit your ability to handle suddenly getting up. So you want to be careful about that. During the class, if there's any suggestion of dizziness, chest pressure, head pressure, suddenly feel like breathless when it shouldn't be, sweating more than you might expect, or cycling percentage, you stop, because that means that there's some issues with the blood pressure and perfusion to their organs. You can certainly cool and neutral room can help, and generally avoid outdoor sessions in heat and humidity with these clients. Again, your language should be emphasizing ease, smooth rhythmic breathing, not competitive. Most humans are competitive, look at their neighbor, try and mimic them or show off or do better. They get into that habit. You don't want to do that here. And they should go as far as they feel easy and calm. Hydration is important after class. They should get up suddenly. No, they should get up calmly. Yes, encouraged to sort of do this daily 5 minutes and develop the resilience. So you can build over time again, very good at it, but these are people you want to be very careful with. Okay, so key takeaways is effective adjunct blood control. Even American Heart Association recommended, so it's now everywhere recommended if you like. Worldwide is something you could ask and maybe get in your clinic or get somewhere. And the best evidence is balanced programs where you put all three, and maybe both drugs, I would say, when those studied separately. I think that will be the most appropriate way to do this. And safety first. And we went over a couple of times on purpose, avoid inversions, breath retention, intense heat of strain, and modify poses that may require that where your head is elevated. So your head is not down and your heart is above the head. Okay, and these are some references. Good. All right. So that's the artist list as of today. I didn't go over the Course-Jan data because they're not randomized, but they of course show some benefits. So they all part of the same family, so they'll work. And again, as we emphasize, one of the reasons we do Course-Jan is that it is your spiritual goals that are the primary, right? And so it's almost like we're getting all these benefits that these studies show for free. But we shouldn't lose focus on our spiritual goals, the one that we're targeting, because that helps in many ways, including this. So I think this study is taking one piece away for medical benefit. It's good to see that, good that they've shown it. It reassures in our practice. But our goal is more to take the higher road and use the spiritual benefits as our driver, not just the physical benefits. Just be aware of that. And I think your clients would like that because you as a better person, better rooted in who you are, and knowing reality is usually what about for everybody. And this is a way to kind of get them in, but that's probably the bigger benefit rather than just the medical benefits. All right, any questions, anybody?
Dr. Devendra, I was just wondering if while taking classes like this, we should read some of these precautions beforehand with a mixed audience or participants. Just would prepare probably a disclaimer sort of a thing in the beginning and just read it, or what do you recommend?
Yeah, I think disclaimers are great. You always, every yoga class will have it. We have a disclaimer. You'll have it, and you generic health issues let us know. So that's absolutely correct. So that's sensible, and you need that. But I think it takes a little step more than that.
Right.
So if
That's
they have blood pressure, then you go on dialogue with them. Look, these are risks and benefits. You can make a statement, blanket statement with more than one, but individually can talk to them. Look, there's some issues like this, then
Yeah.
you want to take care.
I mean,
Because I think it's the awareness of what you're saying. They might say, I don't have it, I'm fine. They don't quite understand. So, papers know
is it safe to ask the audience that um, are there people who have blood pressure raise their hand or something like that, identify themselves? Is that appropriate to do that, or they not is that asking too much for confidentiality reasons? Or
So what happens when you ask in public is that person's choice to tell you. So there's
right,
nothing wrong. It's not necessarily like I can't do it in a hospital, but you can do that because it's that person's choice to turn head or not. It's their choice they want to be known or not. You're not asking them to ignore their feelings and say, asking, look, if you're comfortable, raise your hands.
yeah,
You curve, right? It's okay, nothing wrong with that. And because I want to show you different poses, completely okay.
yeah,
Right? But so no, the HIPAA doesn't apply. It's not using data for anything that is not private, and they're letting you know themselves. That's completely legitimate. But if they're telling you, then they're right to tell you. Like,
yeah.
you
Or
can
when
say that just
Mhm,
to look more professional, and
mhm,
if it's comfortable or wants to be on that side with high blood pressure, because I might show you different poses,
yeah,
and I don't want you to my pitch maybe for the others, I might forget. So let's see one side so that I can direct my pitch to what you might need. Because we're all trainers and we sometimes forget because we're into our flow or our membership, we start doing it.
yeah,
He's not seeing everybody there, right?
right,
So you can say that, and I'm going to show how I do yoga, but blood pressure is something not good for you.
yeah,
You can do that any which way. I think it's okay.
yeah.
Yeah.
And we have to be sensitive to these conditions, blood hypertension, of course. There are some restrictions for diabetics and other health conditions, as we are learning in this class. So to be able to show awareness that we are aware of certain restrictions that need to be followed with these exercises, or the activities that we are going to perform. So
Yeah, and to your point, uh, we could make as I say, it sometimes for each pose, you know what's good,
yeah,
bad, right?
that's right. I was just thinking that
Yeah, and that's a better way because you know the pose better and you
yeah,
know it.
just
You learn it. But then you can have a list also if you want at the end saying, oh, there's two ways to do it. But when you learn and you don't know the pose inside out, right? Benefits to use it. So you better learn per pose, even if it's repetition, because you remember that. You don't look at the list every time, you're going to just know it. Then you add the list to your memory. Forget about the check, but you should have a general idea that these are poses or mudras that I think are beneficial.
yeah,
And so I think it's better to learn per pose, per mudra, and then per disease also. So multi-dimensional learning.
right.
Learning doesn't work by one dimension. It has to be multi-dimensional. And you'd be surprised what memory will bring out when you're in a situation. It's because you had multi-dimensional waves presented to you. And maybe a visual click or a statement click or the emphasis clicks or a slide click as an image. Our brain retained that memory. You don't know why. And then when it comes out, it's, oh my gosh, I need that. Because not all learning is necessarily linear, right? It's sometimes emotive, locked in some place, visuals.
Yeah,
Maybe the way Dr. Raj said it, it clicked because, remember that. So I think it's a complex way to do it. So I like it when we do it for multiple angles because it'll sink in. We've gone in more detail than we used to in the medicines and the pathophysiology, what's a mechanism disease. And then you're the first guinea pigs. We've not gone this detail in the past. So at the end, you have to let someone else how they felt. Our interest was that if you hear from multiple points and even the micro level, right, that might help you have that embedded, so you get the feel for it. The vessels are tight, high pressure, your vessels are tight, they're narrow, the blood flow is limited to the organs. You just feel it. So when you do some poses, you realize, for you, this may be, let's just think about it. So you have this feeling rather than a memory of a number and a pose. Your system is doing this to you. That image might help you. That's generally how most health workers are trained. I'm not talking about doctors, and even medical assistants, they're all. So there's some basis, there's some feeling that this happens, this is likely to happen. That's the idea of this, because it's not something you remember, but you get a sense of it, he'll come to you.
Yeah, I learned today from your talk that why I was always wondering why certain people shouldn't hold the breath. But you mentioned today that because it raises the blood pressure?
Yeah.
Okay.
If I put a cup and you hold your breath for a while, you get something blood pressure to go up.
Blood pressure to go. They already have high blood pressure and goes even higher. Okay.
Yeah. Don't forget, I'm okay, you're okay, but let's my blood pressure is 160.
Right.
And I go to 180. I'm very close to the headache point. Right?
Yeah.
As age goes by, I'm talking about the regular person. And I might get to a point where I start getting my headaches. And I start risk of stroke. So, I don't want to create that. We're not going to help you. If I can go in, I don't find a shop in the bar, but I want to create that. That's not what you guys for. Meditation is the opposite. So that's why. Okay. But just a caveat is that if you start doing slowly 5 minutes a day, you'll develop tolerance. Your system won't react. So individually, when you're comfortable, you can take some. So let's do it slowly and just comfortably do it. Make sure okay. Then you probably find if you do slowly over time, just like when you do your lotus pose, you might get there without causing damage, right? So individually, you can take somebody like in some studies they took hypertension that are severe, and they made progress, but it's very carefully done. But generically, when you're at this stage, you don't want to take a risk. You want to do it like this. I think so. I would say you guys are helpful in those hypertension. Also, you have to figure out how to get somebody who's like some levels, got a lot more experience, and figure out how to get them going. I'm pretty sure that they'll benefit, but not at our level. I think we should keep it simple.
Okay. Thank you.
Good questions, really. Those are discussions that I have because obviously, and the risk isn't going to collapse. It's just a good practice, right?
Yeah.
If you do it once, and that's fine, nothing happens. It's just good practice. Quality practice. Nothing's going to happen to them. They're going to be fine. But then they keep doing it daily. Maybe it's not fine. So it's just what you want to teach them.
Right.
But prevention is, I think, important. I can't emphasize. Luckily, we have some young people also emphasize a part of this tool to prevent disease. I think that's probably much bigger bang for your buck. Streets, home, and your time, spiritual benefits are there, and you keep doing this. And that's one thing I keep harping on how we missed out on our upbringing. The British came and they destroyed our culture and our schooling. So we've lost these things that we used to have that were inherent in our heritage. So we probably want to rethink for kids and grandkids to incorporate this back. And this data, this is how we give this data as we tell them. This is data. This is not just me telling you this data. Why? It's our wisdom.
Scientific evidence. Yeah.
Yeah. And so, I think we start afresh from grandkids. Often what happens is wrong with the kids. Just saying in that generation, I'll say grandkids per se, but that new generation, we should emphasize this as part of their being and part of brushing teeth. It's more important than brushing teeth, maybe. This is important. More important than physical exercise sometimes because they have to be level-headed. So prevention, I think, is very important. I can't keep emphasizing that. So if you can keep that in your mind, I think that's going to a lot. So if people don't have it, decide they don't have it, right? You learn because you're going to get it one day because the systems are so high. So the systems are so high. Make sure you listen to this.
Yeah.
Don't turn off because I don't have diabetes, so I don't need to listen. No, you need to listen. Exactly, you need to listen to prevent it. It's far more better for you that the person already got it.
Yeah.
Right. So very important. Any other questions?
Modi wants to say something.
Devendra bhai, your audio was, not clear entire time.
Okay. So you think the audio won't take properly then? You think?
In
Because
the voice,
Yeah,
the-
if you turn off your video, maybe possibly it may improve.
turn off what? It's still not clear.
No, you're
Oh.
breaking a lot.
That's interesting. I wonder if it's like that. Because I got good internet.
There is a static, in your audio.
Okay. Same room, same place. I don't know what's happening. Do you think it's on my computer, maybe? I wonder.
Yeah, if you can just try, to turn off your video and see if that helps. Sometime it does, but not
Yeah.
necessarily it will help.
Yeah, let me just turn everything off. Yeah, nothing's actually running. That's interesting. Yeah, apologize. I'm not sure why. It's the same location, same place. So I wonder internet's pretty good.
It is better now, just
Okay.
last couple of seconds were better.
Got it. Hopefully that tape recording will be okay. I will double check that. I can voice over it, I suppose, if I need to. There's the YouTube link. I'll listen to that afterwards. Because we're gonna package this for future, so we've got to get it right. Thanks for letting me know.
Yes.
is in the
Thank
same
you.
condition. And the voice is not so much clear, so might be in this lecture you have to record it separately.
I can voice over it against some of you. I'm not sure why that happened. You told me I didn't realize, but
Are you talking from your hospital or somewhere else?
no, same place. It's the same place I talked from. So I'm just surprised, but maybe so as Dinesh said, something was on in my laptop that's taking some of the power.
Okay, so now it is the time for meditation.
Yeah, Samiji.
Yes, who is ready?
I'm good, I can do today.
Okay, you can.
Thank you. So Jai Jinendra, everyone. Sit in a comfortable posture in a Sukhasana. Please make sure your head, your neck, your spine is straight in one line. Close your eyes gently. Sit in Dhyana Mudra. I will recite Om 3 times. I'll turn off my audio. We can recite offline and then I'll turn on my audio again. Just exhale and inhale a couple of times. We'll take the resolution. I am practicing Vriksha meditation for the purification of my psyche. I am practicing Vriksha meditation for the purification of my psyche. I am practicing Vriksha meditation for the purification of my psyche. Now we'll practice the relaxation called Kaiser. Let's concentrate on the big toe of your right foot. Allow your mind to spread throughout the toe. Suggest to the muscles and nerves to relax. Relax, relax, relax. Experience that they are relaxing. Experience that they have become relaxed. Now attend other parts of your right limb, starting from all the other toes, the sole of your foot, heel, upper part of your foot, ankle, calf muscles, knee, thigh, to the hip joint. Experience they are relaxed. Shift your attention to your left limb. Relax all the part of your left limb, starting from big toe of your left foot and the other parts. Experience the whole of your lower part of your body is completely relaxed. Now move our focus to the middle portion of your body, starting from the waist all the way to the neck. Back and front of your lower and upper abdomen, the back and front of your ribs, heart, concentrate your mind on the chest. Achieve the relaxation of the neck muscles, the front and the back. Now bring your focus on the hands and arms one by one, starting from the fingers, palm, your wrist, lower part of your arm, elbow, shoulder. Do the same on the left hand. Experience that the whole of the middle portion of your body has become completely relaxed. And you feel the lightness in the lower part and the middle part of your body. Bring your focus on the upper portion of your body, from your throat all the way to your head. That includes the muscle of your facials, your eyes, nose, ears, inside portion of your mouth. Experience that the whole of your upper portion of the body has become completely relaxed. Allow your mind to travel from the toe all the way to the head and back from your head all the way to the toe. Ensure every part of your body is completely relaxed. If you feel any tensions, any pain in any part of your body, please bring your mind to that part and try to relax. By now, your entire body must be completely relaxed. There is no stiffness. Your body is motionless with complete consciousness and self-awareness. Now let's take an internal trip, Antaryatra. Focus your mind to the lower part of your spinal cord. That is the center of energy. Allow your mind to travel from the lower part of your spinal cord all the way to the top of your head. That is called as center of knowledge. And back from your top of the head to the lower part of your spinal cord. Repeat this again and again. Let your mind continuously undertake the trip inside the spinal cord and pursue the subtle vibrations of the vital energy taking place inside the spinal cord. Pursue them without any like or dislike. Concentrate your entire consciousness on the spinal cord. Allow your mind to rise and fall inside the spinal cord, just like a mercury rising and falling inside the instrument which we use to measure blood pressure. Now we'll practice the perception of breathing. Now concentrate your mind fully on the navel. Practice deep, slow, and rhythmic breathing. By allowing each breath to take the same amount of time. Pursue each inhalation and exhalation through the expansion and contraction of the abdominal muscles, accompanying each inhalation and exhalation respectively. Continue slow deep and rhythmic breathing. Now slowly shift your focus from navel to the inside part of the nostril at the junction of both the nostrils. Pursue each incoming and outgoing breath. Stay focused. Remain fully aware of each and every breath while you inhale and exhale. Continuously practice slow and long rhythmic breathing. Inhale and exhale each breath while remaining fully aware of it. You ensure you fully engage your mind in the perception of breathing. By any means, if you are distracted by any thoughts, do not stop forcefully, but you perceive it and then you again start perceiving your breath. If your distraction is frequent, you may hold a breath for a couple of seconds without causing any discomfort. Maintain the continuity of awareness of breathing. Perceive it without any judgment, any like or dislike. Now conclude our meditation with 2 long breaths and making Om sound. Om. Om. Keep your eyes closed, rub your palms gently and put it on your eyes. You can exhale and blink your eyes. You can slowly open your eyes. Jai Jinendra. Vandami Naman Sami Samniji.
Thank you. Thank you for the good session. This is a breathing exercise, breathing perception. And as Dr. Devendra was telling, that holding may boost up the high blood pressure. So those people who have such problem, they should not hold. They can just continue with the breathing, slow and deep breathing. For them, breathing exercise is also not what we say prescribed. They should not practice any breathing exercise. For example, the Kapalbhati or Nadi Shodhan like this. Because in this, we are taking breath with some speed and the rating of the breathing increases in pranayama. It is not good for the high blood pressure people. Okay, so thank you very much.
Thank you very much. Vandamina Sami Samji.
Very nice, Dinshit. That was very professional. Yeah, very nice.
Vandami Namaste Samniji.
Narendra Bhai.
Samniji,
Yes.
when I'm doing meditation or yoga, pratadhyan, my
Mm.
back keeps itching all the times, so I can't concentrate.
Okay, so you can mix a taping like this, okay?
Okay.
Okay, so how much, whenever you are seated somewhere
Yeah.
in free time, just you have to
Mm.
tape the shoulder part,
Shoulder.
the back